Good evening, everyone, and thanks for joining us on this Sunday night for one of our BCVA student clinical clubs. My name's Sarah Peterson from the BCVA board, and tonight we've got Colin Mason from BCVA as well, also from BCVA board, talking about abortion sampling and taking us through some case discussions on how you can reach a successful diagnosis. So tonight is an informal evening. No question is a silly question. We want you to ask all the questions you have regarding abortion sampling, things that you may have seen in practice, questions that you have from what you've learned at university. So if we could use the chat function to ask any questions, then Colin can pick those up as we go through. And you can also just let me know if you're having any technical difficulties in the chat function too. I'm sure that you're all very used to Zoom by now, but if you can't see the chat box, just wiggle your mouse and the taskbar should become visible at the bottom or the top of your screen, and there you'll see the chat box there. So I'm going to hand over to Colin now and hope you enjoy this evening's case discussions. Thank you.
Thanks very much, Sarah. Good evening, everybody. And firstly, thanks for being here. We were just talking before this went live at past, just thinking, well, it's a beautiful sunny summer's evening. I hope it is where you are too. And it may well be exam season, or you might have just finished exams or whatever right now, but it's perhaps not the best opportunity to get people together on a lovely evening like this. But anyway, we've got a nice group of people here. We've got 25 people on, so thank you very much for your interest in joining this tonight. And hopefully what we can give you is something that's useful, with a few practical things to take home and use. That's the aim of the game, without a shadow of a doubt. So just a little bit about me. So I'm a cattle vet. I work for the SRUC. I'm based in southwest Scotland, and probably for the last 20 years I've been doing veterinary investigation and disease investigation work. So the aim of what we do is to help vets in practice really get diagnoses and investigate what they're finding on farms in terms of getting an etiological diagnosis. So certainly this subject here, bovine abortion sampling, is a very common presentation for us, and it will be a very common presentation for you in practice. And you'll be, not necessarily seeing lots of these, but you will be involved in investigating a lot of these if you're in farm animal practice. And it's actually a really good area to start with, I always think, because it's quite easily investigated. There's quite a broad differential diagnosis list, so it can kind of keep things fairly interesting, and it can be a good sort of foot in the door to doing infectious disease investigations as you go. So can be quite a useful one. So what I want to really do is talk you through what to do, what to sample, and answer your questions as we go. I've got a whole series of slides here, but I don't really intend to use them all necessarily. And what I would suggest is, we can answer questions as we go. So as Sarah says, I'll pose a few questions. If you've got any thoughts or answers to what I'm saying, just pop them in the chat box and we'll go from there. And if you've got any questions as we go through, do likewise, and we'll take it from there. Okay, so let's see how it goes. And if there's any lack of questions or whatever, then I can always fill the gaps with more information as we go. So start off then. So picture of an aborted calf. Okay, so I was on duty yesterday, and one of the case histories that I got a call about, and we got a calf in to have a look at, was from a large dairy herd, permanently housed, about 1,000 cows, and their abortion rate has gone up in the last 6 weeks. So they've had 4 abortions just in the last 2 weeks, and then previous to that they've had another 4 abortions in the previous month, which is a sudden increase for them. So that was the challenge, and they'd found not this particular fetus, but a fetus like this, just at the end of one of the scraper passageways. And that essentially was the first presenting sign of this particular case. They hadn't even identified the cow as such, which can sometimes be a bit of a problem. They were suspicious about a couple of cows that might have aborted, and they were going to call their vet out to firstly have a look, and then to want to try and start to investigate this. So I guess my first question to you is, if you were called to examine this on, it's a good call for a new graduate to go to see, what will be the first thing that you've got to consider? You can't even really identify the cow at the moment. They've narrowed it down to one or two cows. What's the first things you're going to do as far as identifying the cow affected? If anyone's got any thoughts there. Yep. So yeah, we've got rectal for an empty cow, absolutely, and that's a good starting point. Is are they empty at that stage? If it's just aborted, I guess you could still have a quite a distended uterus, so it wouldn't necessarily present as a a completely normal PD negative in the traditional sense of the word. But yeah. What about the possibility of twins? What about an additional examination apart from a rectal examination? Yep. So yeah, looking for discharge, and that's certainly what the farmer would have done. Vaginal exam, absolutely, to see whether there is an open cervix or a closed cervix. On the point of twins, it's always worthwhile checking, because actually the abortion rate in twins is always going to be higher. There's a higher risk of abortion, and twinning in itself is a risk of abortion. It will not be the first time that you have a cow that aborts one calf today, and a couple of days down the line she presents as quite ill, and on a rectal exam or a vaginal exam you find that there's quite a horrible metritis there, and there's a second calf there that's been missed. So that's a possibility that we've got to bear in mind, and it's always worthwhile checking that one out. I always remember, one of the bits of advice that I got when first in practice was, if you're going to call to an abortion investigation, check the cow, find the cow, make sure there's not another calf in there, make sure she's cleansed. That's the other one, or if there's anything else there that needs to be attended to. And I think it's always worthwhile is giving that cow just a good general clinical examination as well. Is she presenting with any other clinical signs? Is she pyrexic? Is there issues with metritis? Is it because of some of the systemic illness as well? Because you could have, an acute systemic illness, you could have an acute mastitis, you could have, plenty of other acute conditions where, the cow is ill in herself and she's presented with an abortion. So as a result of that illness, as a result of that pyrexia. So yeah, there might be a job of work to do in terms of treatment, treating that cow, as well as just trying to identify if she's aborted or not. I think a few other things that's just worthwhile mentioning at this point. Abortion sampling is, I would view it as a great opportunity to get involved with infectious disease investigations on a farm. It's very often an indicator disease, an indicator presentation, rather, not an indication of disease, but an indicator presentation that there's something amiss with a farm. It could be that it's a new infectious disease that's come onto the farm. Very often they'll present as abortion. So, for example, if you take something like IBR or Salmonella Dublin, the first time that might present on a farm, it might present as abortion. Actually, some of the new and emerging infectious diseases, new diseases that might come along, maybe the first presentation of that might well be abortion. So always bear it in mind. Anybody got any idea what the diagnostic rate is for abortion? So if you examined 100 fetuses that had aborted from 100 cows on 100 farms, what do you reckon the diagnostic rate would be? What percentage of those do you think we get a confirmed etiological diagnosis? 20%, someone's saying. Any advance on 20%? 30? Yeah. Okay. I think the main take home here is pretty low. And I think that's a fair comment as well. Someone's gone as high as 50%. I would like to think that the 50% is nearer the mark, in that I think we probably get a diagnosis from half of them. And there's lots of reasons why we might not get a diagnosis. And I'll touch on that in a second, or maybe later on in the presentation. I've got a slide on that. But I guess we've got to think about, well, how many of these abortions are just, I suppose, normal. We'll come on to that in a sec as well. How many of these abortions would you expect in because of a sick cow or a traumatic incident or a stressful incident or whatever it happens to be? I think another thing that's worthwhile you all bearing in mind is one of the things that puts farmers off getting abortions investigated is that they think that they might not get an answer. And actually you can turn that on its head a little bit, in that I actually think quite a good message to give to farmers is that if you've comprehensively examined an aborting cow and a fetus, and you've screened it for a whole barrage of infectious diseases, as we'll talk through how to do in a second, and you've found nothing, then that's actually a really good thing. You could say, right, well, we've screened it for, BVD, IBR, lepto, salmonella, all the bacterial causes of abortion, and we've not found anything. Actually, that's quite a good news story for the farmer, even though they might perceive it as not being a good news story, and that they might say, oh, well, you didn't get an answer as to why my cow aborted. But you can turn that on its head. And in terms of general disease monitoring on a farm, in terms of health planning for how to monitor what's going on a farm, in terms of new and emerging diseases, new infectious diseases coming on, it's quite a good one. So another question would be, therefore, from your point of view as a vet, what would you say is a normal abortion rate for a herd of cows? So what would we consider normal? And by abortion, I mean you've got the fetus to let's say day 40 of pregnancy. So she's been pregnancy diagnosed at somewhere between day 30 and day 40. She's confirmed in calf. You've got a nice secure calf there, hopefully, and then it's embryo loss after that stage. So late embryo loss or abortion. What percentage is normal for a herd? Anybody got any suggestions? Less than 5% is one, certainly less than 5%, about 2%, yep. So yeah, I think we're all in the right ballpark there. So yeah, somewhere around about 2 to 3% embryo loss post-PD is normal. And that's probably about as good as, a herd of cows can be naturally and normally. There is going to be some degree of embryo loss naturally without infectious disease necessarily going to be involved. So yeah, that's real. I think where we've got to maybe consider it through health planning is that where you get a whole cluster of abortions coming together in a short period of time. And yet bear in mind also that with seasonally calving herds, whether that's a spring calving dairy herd or a seasonally calving suckler herd, you tend to get the abortions all clustering together anyway. So very often December, January time, as the pregnancies enter the third trimester, if it's a block calving dairy herd or a spring calving suckler herd, that's very often where we'll see the abortion. So they might well cluster anyway. And for herds that are all year round calving, it sometimes needs a bit of a review through health planning to look at the abortion rate, because if they're occurring sporadically, one this month, one next month, it may not really register with the farmer necessarily. It depends on how on the ball they are, and it might only be through reviewing that through health planning that you actually suddenly realize, oh crikey, the abortion rate for this herd is actually running at 6%, 7%, something like that, rather than the 2 or 3%, which is normal. So having some handle on that, I think, is important, just so that you know what's going on. And one of the questions that you always get asked, I suppose, is, well, when should you investigate, and should you investigate all abortions? And there's an argument that you probably should investigate them all, because it's an indicator disease, something's changed in that animal, and it's giving you an opportunity to see, has something changed in the herd? So there is an argument for looking at them all. In reality, that probably doesn't happen. And for most situations, it's usually the second or third one that gets investigated, particularly if the abortion rate is rising above, let's say, 3%. I'll just talk you through this slide. So, just in terms of defining what it is. So we're really saying, abortion is pre 270 days, thereabouts, if we know the service date. And that's actually linked in with the brucellosis order. And then a stillbirth is really 270 days onwards until up to 24 hours after birth, depending on how things are going there. So those are some of the definitions, which is worthwhile just bearing in mind. And yeah, this is what we've just talked about, is, all investigations begin with the first case. Probably worthwhile looking at, well, any abortion really is worthwhile looking at, but certainly if it's over 2 to 3%. And always bear in mind, and there's even APHA will accept that reporting of abortions is nothing like what it should be. It is underreported. But for beef herds in particular, abortions should be reported to the local APHA office, and they will also stipulate whether they want you to go out to do statutory sampling for brucellosis or not. So that'll be another reason why perhaps you'll get a call to go. Okay, I'm going to slip over these slides and then move on to histories taking. Okay, so I think history taking from a farm point of view is important, and there's really two levels, is the farm history and then the individual animal history. And these are some of the key questions that I think are really important for you to know about what's going on that farm. Now, you might well know them all already if you're regularly involved with the farm and what's going on. But I think it's really critical just to get a feel for these as you start out in your career and you're getting to know your farms in your first job, is to try and build up a picture of what's going on in these farms, and knowing what's going on there. So some of the key really obvious elements will be herd size, group size, barren rates, previous abortions, previous diagnoses, those sorts of things. Replacement policy is a real important one. And knowing what the replacement policy is it, are they buying in heifers, are they buying in cows, are they importing, I think is a valid question to ask as well, just because of the variations that you can get with different diseases from mainland Europe versus what's in the UK. So that's an important one. So just getting all of that background is important. Okay, so that would be the sort of history we want on a farm level, and then there's the individual animal history as well. So those are some of the obvious things that we need there, in terms of where she's come from, etc., etc. Her vaccination status, you'll know from the herd information and from the practice information, hopefully, what the story is there. But I think it's always worthwhile checking, have they actually been vaccinated, particularly with heifers? Do they fit into the the normal herd vaccination pattern? Have they been missed for whatever reason? etc., etc. So that's really important. Method of service is really, really important. Bull versus AI, really important to know. And then, other factors about the cow herself. Has she been ill? Has she been recently transported? Is there any stressful events in her life? Is she over fat? Is she over thin? All these factors that come into it all. So I guess some obvious questions there to start off with. So I'm not going to dwell too much on that. But moving on to my next question, I suppose, is there's probably 3 sample types that you can take, or 3 areas that you might need to consider sampling when you get faced with an abortion. So if you found the cow, you've got the calf, what are the 3 main sampling areas that you want to go for? Okay, great. So dam's blood, placenta, fetus, dam. Yeah, those are the 3. Dam, blood, exactly. So samples from aborted calf. Yeah, so we'll come on to those in a minute. Probably worthwhile just talking about some of these, just to highlight them. Okay. Firstly, dam bloods, I would always collect a sample. Okay. And get a blood sample from them. They can be useful, sometimes less so. It depends a little bit on the vaccination history for the herd and for the individual cow. We tend to work on the assumption for most abortion agents that by the time they've actually aborted, they are going to be antibody positive to whatever agent has hit them. So that's one of the first things to consider. Doing paired serology for abortions is not usually very, very useful. So yeah, by the time the cow is aborted, they're either going to be antibody positive or not for a particular abortion agent. Okay. So that's useful. Someone's just popped a question in to say, what tubes would you collect? Well, really, we're just focusing on serology. So a red top blood tube is what we need. And we might not even use it straight away, but I think with any of these investigations, red top blood tube would be a good starting point. You can store the sera if needed, or your diagnostic lab can store the sera, and we can fall back on that if we need to. I'll be honest with you, the antibody results that are actually probably most useful when bleeding the dam are the negative ones. If it's BVD, lepto, IBR, Neospora antibody negative, then you can have a reasonable confidence that the cow's not been exposed, and therefore those are not the causes of abortion. Where it's positive, it gets a bit more tricky because it will depend on vaccination status. And what you've always got to bear in mind is that with a herd, having some degree of seropositivity for lepto or IBR or BVD, some of these infectious agents, is pretty common. So you can't link an antibody positive directly to it being the cause of the abortion. You've got to sort of consider that more widely in the context of the herd investigation. So yeah, you can do that. I suppose other tests that you could do, you could look at bulk milk samples to look at herd level of exposure to a whole range of infectious agents. That gives you some general background advice. Sometimes with more complicated abortion investigations, it's actually worthwhile blood sampling some cows that we know have aborted, and some cows that we know have carried calves normally to term. So probably some freshly calved cows that we know have just completed a pregnancy and carried a calf to term, and actually looking sometimes at the difference between that cohort and the cohort that have lost their embryos can sometimes tell you something that's going on. But yeah, so blood samples worth collecting, easy to collect. You might have to collect a red top blood tube as far as a brucellosis investigation is concerned anyway, and then you've got the information to hand. So I think that's really, really useful. So second and third things will be fetuses and placentas. next bit of advice to you, if you're going to look at these things on farms, is really to get the fetus and the placenta away from the rest of the cows as quickly as possible, and potentially, depending on the nature of the cow, to try and isolate her as well. It might be a little bit like shutting the door after the horse is bolted if the cow's been amongst other cows anyway, and there will be some degree of environmental contamination. Yeah, for sure there will, but we want to try and minimize that. So certainly if you're going to be looking and possibly examining the fetus on farm and examining the placenta on farm, then getting that away from other cattle, getting it somewhere where you can examine it cleanly, you can disinfect afterwards, and you can dispose of it reasonably well is a good starting point. Okay, so you've mentioned placenta. I would say if you can get hold of placental tissue, it's always really useful. And I think for the abortions that we look at, we probably only look at about 25% of them we get placenta submitted. When you look at sheep abortions, the sheep guys know full well that placentas are a really valuable thing to collect for abortion diagnosis, particularly if you want to diagnose enzootic abortion in ewes. But for cattle, it's harder to get. Sometimes it's gone, sometimes it's down the slats, sometimes it's been eaten. Sometimes it's so trodden into the straw that it's not worthwhile bothering with. But if you can get it, it's really, really useful. So all I would say is if you're there and you see it and you can get access to it, then absolutely do. And try and impress that on your farmers as well. If you're getting called out to investigate abortion, just say to them, look, if you've got any placenta, if you've got the placenta, if you can keep that, definitely worthwhile having and definitely worthwhile keeping. Okay, so you've got a picture of a placenta there, with a bit of straw attached and everything else, just as you find it in real life. And excuse me, if you're going to examine a placenta like that, what tissues would you look at? What would you want to collect from that? Because you're not going to want to submit the whole thing. So what would you look for in particular? What would you collect in particular? Cotyledons, yep. Okay, so yeah, I think that's right. And yeah, I think the most important thing to do is probably collect, if you can, 2 or 3 cotyledons and some of the membrane in between. And that way you've got it covered. If you're going to do that, then the best thing to do would be to fix some of the cotyledonary material, if you can, in formalin, and also to keep some fresh as well. And actually, probably in a practical sense on farm, it'll depend on how your day's panning out and in terms of what your calls are for that particular day. But what I would always suggest doing is just package up 2 or 3 cotyledons, get them in an arm length glove, tie a knot in it, and then get that back to the practice where you can maybe examine it in a little bit more detail. You can harvest more samples from it that you might want to submit to a lab, and you just basically get it off farm, and get it into into a practice environment where you can look at it in a bit more of a controlled way. Obviously that depends on what sort of day you're going to have. You don't really want that sitting around and rattling around in the back of your car for a couple of days, but that's what I would suggest. Someone else has said discolored areas, and looking at that, and yeah, you're looking for areas of thickening, areas of any sort of inflammatory exudate that's there, any areas of necrosis within the cotyledons. These are the sorts of areas to look for. Also bear in mind as well, it might be focal rather than generalized. Some of the really bad ones, it's a generalized placentitis, but it could be localized to one area as well. So there's a few tips for what to collect there. And then moving on to fetal examination, really, and what do we do there? So I think the first thing again would be is get it away from the rest of the cows. I would always stress, if your practice is relatively close to a veterinary investigation centre, then probably, best and simplest advice would be, if the farmer can run it in there, then get your farmer to do that. And that might be helpful for you if you've got a busy day as well to get that done. But also the sampling that you can do either on farm or in the practice is relatively easy to do, and it's a good opening up to doing on farm PMs for sure. Okay, so there are some absolutely sort of golden samples to look for and to get from fetuses when you start, and we'll talk you through those in a tick. Okay. The other thing perhaps just to bear in mind is what pathology we'll see. I always say to farmers, it's kind of rare very often to see much in the way of pathology in fetuses. Very often one fetus looks pretty much like another one, and it is a sampling job. And we just collect a full sample range, a full sample set, and then we can use that to make a diagnosis thereon. But also you do sometimes see really good going pathology. So I thought I'd chuck in a few pics of really good going pathology that you can see, and it'll give you some indication of what's going on. So the picture top left is a fetal pericarditis, which would suggest most likely a bacterial cause of abortion. In contrast to the previous picture of a placenta, the one bottom right is a really good going necrotic placentitis with necrotic cotyledons and a real thickened intercotyledonary membranes there. So you can see really good going damage there as well. Other things that we might see from time to time, the picture top right, occasionally you can see fungal plaques. So this is the cranium of an aborted fetus, and you can make out the sort of plaques there. So this was an Aspergillus pneumonia abortion rather, and if you see them, it's not diagnostic, but it's certainly an indicator that might be the cause. This is a fetal peritonitis that we do see occasionally. And brain is one of the tissues that's always worthwhile looking at, which can be a difficult one to look at on farm, I do accept, and we'll talk through that in a minute. But looking at brain tissue, both from a sort of a macroscopic and a microscopic point of view, is really, really useful. So you can see in this particular case, you've got cerebellar hyperplasia here. These are the two cerebral hemispheres here. And you've got a little tiny cerebellum here overlying a brain stem. And we can see that in various conditions. So maybe one of the classics would be in utero BVD infection. But also we can occasionally see that, for example, some of the Schmallenberg cases, quite a lot of the sort of teratogenic viral infections that can occur during pregnancy can affect brain tissue and sometimes give you a cerebellar hyperplasia. So again, it sometimes, you get the gross pathology that does help. Okay. It's probably worthwhile mentioning congenital deformities, probably about 5%, something like that, of the abortions that occur will be because of congenital deformities. So they do occur, and obviously, one of the reasons is, the mother, the fetus is not viable, it's deformed, it doesn't make it to term, and it's aborted. So dramatic deformities here in terms of head development, cleft palates. Arthrogryposis is the other one that we see with suspect Schmallenberg, is another quite common one. So a range of deformities can be seen, which can be slightly frustrating in terms of trying to work out exactly what's caused them sometimes, but it just does help in terms of make a diagnosis and decide, is it infectious, is it not, what could be going on in terms of the farmer. I'll just make mention of this as well. This is more erring onto the side of stillbirth, but this is where on-farm PMs can be really, really useful for your farmer clients. Not necessarily to diagnose an infectious cause of abortion, but just to demonstrate what the issues are. And actually, when you get to stillbirth, dystocia is one of the really common causes of abortion that we see. When you get to the stillbirth stage, the last day or two of pregnancy, during the birth process, infectious disease can cause problems at that stage, but it's much more likely to be a combination of anoxia, trauma, slow carving, malpresentation, lack of observation by farm staff that is actually at the root of it. And sometimes I found it can be quite hard to persuade farmers of this, particularly sometimes the pedigree beef guys, or even the beef suckler guys, because they're very much in the mindset that they want a big calf to get a high value product out of it. And sometimes the degree of damage can be quite dramatic. So we've got on the bottom here dramatic hemorrhages. We can have rib fractures, ruptured livers, fractured legs, and then the pictures at the top are more subtle, but they're just basically indicating damage as a result of a slow carving and anoxia. So swellings of the tongue, cloudiness of the eyes, subcutaneous fluid accumulations, those sorts of things. And it can sometimes be a picture tells 1,000 words, and you can tell your farmer that I think the issue is that either your cows are too fat, or your breeding is such that you've got calves that are too big, and they might not believe you, but when you actually see the damage that can sometimes be caused, just looking at weights of these calves, even, it can sometimes be indicative that there's a problem, and it can really drive home that message to a farmer that rather than worrying about infectious disease, we'd be better looking at cow condition, or we would be better looking at estimated breeding values for bull selection, or some of these other factors that might help reduce the issues. Okay, so first, sampling. If you're going back to abortions, before you do anything else, open the fetus up, which can be quite easy to do just with a knife. You don't need anything more fancy than a dissection knife to do it. The ribs are usually relatively easy to cut through. So the first sampling that I would suggest that you get is a sample of fetal stomach contents. Okay, and do that first before you contaminate anything else. And what I would suggest is how you do it is that you just use a standard vacutainer with a vacutainer needle and try to do it aseptically. Okay, sometimes it can be difficult to do in that there's not much fluid in there, or it's very gelatinous, so you need a wide bore needle. So I would probably prefer you with a 16 gauge rather than an 18 gauge needle on your vacutainer, which might be slightly thicker than the ones that you would use for just normal blood sampling. But a wide bore needle can sometimes help get this really gelatinous material out. If you genuinely can't get material out, then you can make a small nick in the abomasal wall and get the fluid out, harvest it out with a pipette, or even just run a swab along the abomasal wall just to get a sample of the material that's there. So those are your options, and that's a really, really important sampling. What are we looking for if we collect fetal stomach contents? What are we actually looking for? What pathogens are we likely to find in general terms? What are the main group of pathogens that we're looking for, and what tests will be run on fetal stomach contents? Anybody got any ideas? Good. Someone said Campylobacter salmonella, so you're absolutely on the right line. So we're really talking about bacterial causes, and that's the critical thing, is that the fetal stomach content should be sterile, and if it's not sterile, then those bugs shouldn't be there. And if you've got your sampling technique right, then you really should get a pure growth of an organism that's in there, because you've not contaminated it with any other contaminating organisms during sampling. So any bacterial cause, so Campylobacter, Salmonella, Bacillus licheniformis is the most common cause of abortion that we get and we see. So that's worth bearing in mind. Listeria, Truparella pyogenes, on the list goes. And they can be really, really useful diagnoses to make. And submitting fetal stomach contents to the lab, they can culture it. They can also do smear examinations on that as well. So you can get an initial look for Campylobacter by doing gram staining. Also fungal organisms in there as well. So your aspergilluses or any other fungal cause of abortion that you would pick up from there. So that's a great starting point, and it's an easy win in terms of what you're going to get. So that's our sort of finding there. Pure bacterial cultures, likely cause of abortion, done, simple. And a little bit of chat there that we've already talked about in terms of the sampling technique. So that's where to go there. Okay, so what's your next sampling that you're going to do after you've looked for fetal stomach contents? There's two very simple samplings to start off with. So, yep, fetal stomach contents is one. What's your next one? And you've got a range of options here, actually, as to where to get it from. Blood. Yep. So blood or fetal fluids. Yeah, absolutely. So blood or fetal fluids. Someone's put vitreous humor. I'm not sure we'd go for that straight away. But yeah, blood or fetal fluids is the way to go, and it's easily collected. It's usually in most fetuses, unless it's mummified, there'll be free fluid in the chest cavity or the abdominal cavity, or very often if you cut into the axilla, there'll be blood there, and either will do. Someone else has just popped a question in, say, is bacillus more common than Neospora? Certainly we find it is, and it's more common in suckler herds as well. Neospora is probably more common in dairy herds, but Bacillus licheniformis is certainly for suckler herds the most common cause of abortion that we get, and it comes from silage predominantly. In fact, I'll give you a quick update on Bacillus licheniformis just very quickly. Could talk about that in a lot of detail, but one of my colleagues did some project work on this, looking at silage and looking at different silage types to see the source of Bacillus licheniformis. And I guess the main summary that I would give is some silages are really high levels of the organism there. So Bacillus licheniformis farms in the left-hand side and control farms with a very low abortion rate and no confirmed diagnoses. Quite a difference in the level of counts for Bacillus licheniformis. So that's one take-home message. And what I would always say if you make a diagnosis of it is be careful about feeding the best quality preserved silage, and also for feeding, for making sure that the water supply is as clean as possible. So cleaning out water troughs is really, really useful. So if you just look for a second, just to sort of validate it, these are the sort of ranges of counts that we got from just average silage on either affected farms or control farms. And then if you looking at badly contaminated silage from the top of the pit or the side of the pit, a massive leap in terms of magnitude for the level of Bacillus licheniformis contamination. So one of the key take-home messages for your clients would be, yeah, not necessarily the best nutritional quality silage. We don't want to get these cows too fat, but getting silage that is as well preserved as possible and avoiding poor areas, avoiding the sides and the tops of clamps to late pregnant cows. We see the majority of Bacillus licheniformis in the last couple of months of the pregnancy. So it's probably the last 2 to 3 months where this is particularly important. The other one is water troughs, and that the sediment at the bottom of water troughs, which is actually very often the stuff that drops out of cows' mouths anyway, is a really rich source of Bacillus licheniformis. So cleaning out water troughs is also one of the things that we would always advise people do. Okay, talked a bit about placental sampling already, so we don't want to mention much more about that in terms of what to do. Yep. Fetal fluid is the other one. So we've talked about that, collecting fetal fluids, and yeah, there's various places you can get it from. So fetal blood just from the axilla like that, or say chest fluid, abdominal fluid. What are we going to test that for? What are we looking for there, and how can that be useful? Antibodies. Yeah, someone said antibodies, and that's right. So I guess the first thing is there's only any point in collecting this from fetuses that have a functional immune system. So if you go to one that's a really small, very early pregnancy, around about 4 months or something like that, then it's debatable whether you might have a fully functioning immune system. But certainly 4.5 months, 3 to 4, yeah, 4 months onwards, then you're okay, really. In that the logic is that you don't get the agent, but you get the antibody, the fetal antibody response to the fact that that agent was there. And again, that's diagnostic. The other one is that if it's a stillbirth or it's a weak calf where the calf's been stomach tubed with colostrum, then don't bother testing it, because they'll be positive for antibodies as a result of the colostrum that's been stomach tubed into it. But out with that, it's really, really useful. And we can test straight away for BVD, lepto, neospora. Those will be the main 3 that we can test for. We can also test for Schmallenberg, and we can also test for BVD virus on that fetal blood or fetal fluids. And again, if you get a positive, then that's your diagnosis made. One of the questions that I always get asked is, what about fetal quality? Sometimes these fetuses, they can be cooked in the cow for a number of days or weeks after they've died and before they've aborted. So it's like a bit of a horrible oven, really, and you can get quite a rapid decomposition of the fetal material. And in that situation, fetal fluids is perhaps, for the serological tests, the ones where they might get compromised and sample quality can affect the result that you get. But the other tests are still very much valid. But if you're getting a fairly fresh fetus, then fetal fluids are worth a go. And I would always say, if you can collect it, it's worthwhile testing, it's worthwhile sampling to do that. Okay, so that's what we're going to get for fetal fluids. And again, dead easy samples to collect, and that's the range of antibodies that we can look for. Schmallenberg as well. We can look for the virus and also look for antibodies in fetal fluids. So again, easy diagnoses to make, and if you can get negatives there, then you can rule out with a reasonable degree of confidence. So to be honest, if you get placenta and you get fetal fluid and you can get fetal stomach contents, then you are a huge leap forward in terms of what diagnostics you can do. And you can rule a lot of diseases out that way, and you can rule a lot of diseases in that way, and you can approach a 50% diagnostic rate straight off, which can be quite helpful. There are other things that you can do and sample to refine it a little bit further. I'll maybe skip over the Schmallenberg chart. We can come back to that in a minute. So thyroid gland, first and foremost, is worthwhile considering for late pregnancy animals and stillbirths. And the thyroid gland is going to be useful for looking for evidence of iodine deficiency in goiter. And you can see the difference there, the thyroid gland on the left, and then there's massively enlarged thyroid glands on the picture on the right. My tip is, if you're going to collect it and you're going to dissect it out, if you basically have the fetus upside down and you skin the ventral neck and the ventral head as well, just skin that there, cut down through, leave it all intact though. Just leave the larynx, the trachea, the tongue, the pharynx, the hyoid, leave it all intact, and you can see the thyroid just sitting there either side of the larynx, and you've got a lobe of tissue each side joined by a bridge of tissue that joins the two together there, and that's a good starting point. And that's the easiest way to get there and to dissect it out straight away, and it's easiest to do it. Okay. What I would say, if you can, is what we would do is weigh the thyroid to see if it's enlarged. And rough rule of thumb is that if it's over 20 grams in weight, and certainly if it's over 30 grams in weight, then it's tending to indicate that there might be an issue. So it's worthwhile maybe taking it back to the practice and weighing it. However, that's not diagnostic for iodine deficiency, and the further follow-up tests that we can do are to look at histopathology and look at the cells there to see if there's any damage to the cells and any colloid in the cells, and also to look at thyroid iodine content as well if you really want to diagnose that. But it's only really of relevance in late pregnancy fetuses if we're thinking about an iodine deficiency issue. Okay, so that's one other tissue to collect. The others that I might also go for just is, as far as actual visceral samples is concerned, would be a bit of lung, a bit of heart, and a bit of liver. And those three tissues to go for would be useful as well. And we'll come on to maybe what we'll do with those in a second. Okay, so we've just got this basic sampling set of placenta, stomach contents, fetal fluids, thyroid if it's a late pregnancy animal, lung, liver, and that will cover the majority of things. Now, brain is a really, really useful tissue to have if you can get it. Really, really useful to get it. Sometimes not the easiest thing to get on farm, and it is a sort of situation where it's easier, you know, if you're submitting the tissues to a VI centre, it's really, really useful to do it, and easy to remove the brain there. It might be simpler for you in a practice context to again collect the head, take the head off, take it back to the practice. I know it sounds a bit weird, but do that dissection back in the practice rather than on the farm. Might be a little bit more palatable for the farm staff as well. So certainly very valuable if you can get it, and I would highly recommend that you do. Again, just basically 3 cuts to remove the top of the skull off. Sometimes if it's a really immature fetus, then you can actually use scissors to get through it. Remove the whole brain, including brainstem, and fix it. And that's what we really need is the brain to be fixed for histopathology. And what a lot of vets in practice will do is hold those tissues in the practice, not submit them necessarily, but just keep them. And the way we would work it is it's always second level diagnostics really, as far as these abortions are concerned, is to do the first tests on the fetal fluids and the fetal stomach contents to start off with. And then if that draws a blank, we don't find anything, is maybe go to fixed tissues, including fetal brain, to see how we go. Another thing to bear in mind as well, if you're looking at brains, is that if you've got let's say a 6-month-old fetus, a 6 to 7-month-old fetus or younger, the brain will be very friable, in that the fibrous structure and also the myelination of the nerves as well will not have fully formed at that stage. So what you find is that the brain at that stage is very, 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 very friable, almost to the point where you might be looking at it thinking this is really badly autolyzed and it's not worth collecting. So just bear that in mind. It definitely still is, even if it comes out in bits, it's still worth collecting. So what I would say is, you know, make sure you get it if it's useful. Excuse me, my dog is barking in the background. Okay, let's get rid of the dogs. Someone's put a question in saying what will be the tissues of interest from brain. Sorry, what will be the disease of interest of brain, which is a really good question. It can give a lot of indications about a whole diverse range of disease presentations, to be honest. It can back up a lot of your diagnoses, but the one that it's really, really useful for is neospora, and making a definitive diagnosis of neospora abortion. brain tissue, and some of you might have picked up that I'd said heart muscle as well. That's where the tissue cysts of Neospora will be present, and that's how you would make the diagnosis. So that's really, really where I would go to start off with. If we're looking for some of the in utero BVD infections, then they're very easily picked up on brain. And then some of them are weird and wonderful stuff, like some of the Schmallenberg diagnoses are made on brain, and there's tissue as well. But the main day-to-day run-of-the-mill one would be Neospora, and that's a good one to go for in terms of trying to drive what you do. So yeah, that's actually the picture here. I'm no histopathologist, but you get these non-suppurative foci with the Neospora cysts. So you've got an accumulation of monocytes and lymphocytes around a sort of central tissue cyst core. And that is the typical thing that you're looking for either in heart muscle or brain tissue with Neospora. And you've got an absolute confirmed diagnosis that it's there. And then that can be helpful. There's obviously no treatment or vaccination for Neospora, but it can be helpful in terms of how you go, in terms of what you do. And actually, it's worthwhile just mentioning this because this is really cool, I think. And this is just a slide about Neospora control. And I'll just talk you through this. As I say, there's no treatment for it. There's no vaccination for it. And what we know is that cows, generally speaking, are carriers for life with Neospora. And we know that cows are statistically more likely to abort if they're positive for Neospora. So if she's an antibody positive cow for Neospora, doesn't guarantee that she's going to abort, but she is statistically more likely to, and therefore is not as likely to have as long a life as she otherwise would. And the way that some proactive herds are now controlling it is essentially trying to breed it out. What we know is if the dam is positive, then the calf will be positive. And following up on that, what we know is that you could potentially, identify your carrier cows through blood sampling. You could breed them to beef, and then you could use sex semen on your negative cows and breed them to breed your replacements off that. So you're actually going to breed the disease out of your herd. But this is a really cool piece of work where they basically took carrier cows and they bred them to different sires. And the take-home message basically is that if you breed a Holstein to a Holstein, that animal is more likely to abort. If you breed a Holstein to a beef cross, the abortion rate is much lower. So it really reinforces the whole theory about trying to breed it out. Not only do you keep your heifer replacements as hopefully negative and not carriers, so you breed it out over time, but statistically your beef cross animal is much more likely to survive to the end of pregnancy than your Holstein purebred. And actually Limousin came out best for that in terms of the sort of the survival to the end of pregnancy. So it actually gives vets a really neat way forward, I think, in terms of trying to control Neospora. It's a real frustrating disease because we're talking about an abortion rate of perhaps 2 or 3%. Well, very often with endemic Neospora herds, the abortion rate will just sit at 6 or 7%, and that's pretty crippling for a herd. If that's the abortion rate, then that's a lot of cows that are going prematurely and not performing to their optimum degree, and it can be bred out over time. So it's pretty cool. Okay, I'm conscious of time and we're getting to the end. So just a few final things. Histopath, what can we get from histopath? And again, what I would get general take-home message for you guys is, if you're going to collect a fresh tissue, then fix a bit of it as well. And that applies to on-farm postmortems as well. If you're going to collect a bit of fresh tissue where you think there might be a lesion for microbiology, let's say, then fix a bit of it as well. And then it costs you very little to do that. And then you've always got that tissue to fall back on. So with abortions, I would always go for frontline diagnosis will be based on the microbiology, the fetal fluids, the fetal stomach contents, that sort of thing. But then you can always use histopathology as a backup, and that will refine your diagnostics. And we'll certainly do that from a VI centre point of view. But liver, we get IBR lesions in the liver. That's where you might pick those up. Lung, gives you evidence of fetal pneumonias, so it kind of backs up the bacterial diagnosis, perhaps. Heart for Neospora, brain for Neospora, and some of the other conditions that I'd mentioned. Thyroid potentially, again, for evidence of iodine deficiency, and you know, we can pick up placentitis that might not be evident grossly, sometimes for histopathology as well. So question coming back on the Neospora says, so if a seropositive cow carries a calf to term and is born alive, will that calf be seropositive? Yes, that you've got it absolutely, Lisa, in that basically that's the way that the disease perpetuates in a herd. So antibody positive cow, her calf will be antibody positive, and that will be carried to term. Yep. Will be a completely normal calf, but if that is a heifer in the herd, that heifer is statistically more likely to abort, not guaranteed to, but is more likely to. So that's how the parasite, essentially, it just perpetuates this cycle of, you know, ongoing abortion if it's not controlled over time. So that's how it works, and that's how you can really break the cycle through ongoing testing of the cows, and then, you know, selective breeding of how it goes. So yeah, I think this will be my final slide just now, is a, you know, just a summary of what I would want you to do. Fetal stomach contents, yep, fetal fluids, fresh placenta, fresh liver, potentially fresh spleen, although not essential, and then also get some fixed versions of those samples as well. Submit the first line samples. That'll get you a long way to getting a diagnosis, and then, you know, follow that up with the other fixed samples if you need to. And that's a great start in terms of getting a diagnosis and seeing how you go. Oopsie daisy, just made that very big. The other thing to say, and we supply these, and speak to any labs that you're working with, is abortion kits. And it's just a neat thing to be able to have in your car, I think. And if you've got 2 or 3s in your car, or you can make them up yourself if you want to, it simply, you know, you've got all the material there that you need to sample. So if you happen to be on farm for something else and they say, oh, I've had a calf abort, you know, and you instantly want to jump in there and say, oh, I think we should sample that calf, then, you know, just having a kit sitting there ready to go with the right vacutainers, the right needles, the right pipettes, everything just sitting there ready to go. You can quickly take the samples that you need, and that really is likely to give you a pretty good chance of getting a diagnosis. So we supply these to the vet practices that we're working with. So you can always get in touch with us if you want them. I think it is a useful thing to have in your car so that you can do that. And I would say probably, you know, maybe we've now look at far more abortion material than perhaps we used to do, because we're getting this material sent in from practitioners on farm, perhaps where we wouldn't have got it in the past by farmers having to drive in with a calf. So a useful one. Okay. So hopefully that just takes you through some of the strategies, some of the things to look for, some of the sampling to do, some of the diseases that you can get. One of the challenges I said at the start was, well, why don't you make a diagnosis? And again, I would always turn this around and say, well, it just gives you an opportunity to screen this animal and find something or rule something out with confidence. And these are some of the reasons that you might not get a diagnosis there. I'm not going to go through every single one of them that you can read, but a lot of them will either relate to sample quality, as in it was very autolyzed, or it was mummified, or you couldn't get the placenta, or indeed it was not an infectious abortion. It was trauma induced, it was stress induced, it was drug induced, it was nutritional, and it was twinning or something like that. So there's a whole range of reasons why you might not get a diagnosis, but I hope, having sort of listened to this and discussed this for the last hour, it gives you a feel for, you know, what you can do with this material, why it's not a wasted opportunity, and why hopefully you can use it to the best advantage, both for yourself to learn a bit more about what's going on the farm from an infectious disease point of view, but also, you know, to help with health planning to control infectious disease on the farm. Okay, so that's me gone on for just over an hour. That's maybe gone as far as I think I need to do. Hopefully that gives you the background. If there's any more questions that anybody has, please fire them into the text box and I'll try and answer them. Any questions that you might have, I'll try and answer them. Here to help, and always make friends with whoever's working in your local lab and, you know, work with them and ask them questions as well.
Thank you, Colin. That was a really, really useful overview of approaching an abortion investigation, and some really useful tips for everybody in there. As Colin said, please fire in any questions that you've got into the chat box. I've got one actually, Colin, which is just related to Neospora, and it comes up quite a lot. What advice do we tell the farmer about his dog on the farm? He's just got a new puppy that he's brought onto farm. He's had an abortion storm due to Neospora. What should he do with the dog? Yeah,
don't get rid of the dog is the main take-home message. Keep the dog. Firstly, the abortion storms. The question that Lisa asked about seropositive cow giving birth to seropositive carrier calf, that's the commonest way that Neospora behaves in a herd, in that it's kind of an endemic drip effect, which will be significant and it will erode productivity over time, you know, with a 5, 6, 7% abortion rate or something like that. The Neospora abortion storms, thankfully, are really rare. And I think I've probably only seen maybe 4 or 5 in 20 years, thank goodness, because they can be really devastating. And, you know, you could suddenly get 20, 30 aborting cows in the space of a week. And that's because of a point source of infection that infects a lot of cows orally in a short space of time. And usually when it occurs like that, it will be dog feces that's contaminated with the oocysts, that's got into the feeding, usually got into a TMR mixer, been nicely mixed up and then fed to a lot of cows. But the dog actually only excretes oocysts in its feces for a very short period of time, and the window is probably be about a fortnight. So the life cycle, as you can probably remember, is that the dog would have to be eating placental material or aborted Neospora fetus. They then produce oocysts in their feces, then gets passed out, and if that infects a cow, then you can rapidly set up this sort of infection cycle. But that excretion of the oocysts is just for a very, very short period of time. So actually, by the time you've got the abortion storm, the dog will be okay. It'll not be causing any more problem at that stage. Always the advice, which is one of these classic bits of veterinary advice that's very, very hard to do, is, you know, they keep dogs away from, you know, cleansings, dead calves, abortion material on farm. Now, yeah, ideally, yes, that's what you do, but it's very, very difficult to implement in practice. And it can be new dogs coming on for the first time. So that's the situation. Okay.
Great, thank you very much. And just one question that's come in here, which was, what was the cause of abortion in your initial picture or case?
So that actually was a salmonella abortion, but a salmonella Dublin abortion, which is one of the most common causes that we make in dairies, and it's one of the common ways that it presents in a dairy. Although you couldn't tell that by looking at it. It's only, and that probably highlights the point, is one aborted calf looks very like another. And really, you've got to take the samples to pull out the specific diagnosis.
Brilliant, thank you very much. Well, I just want to say thank you to everybody that's joined us for tonight, and especially to Colin for talking to us on this sunny evening about abortion case investigations. Our next clinical club is going to be a panel discussion, which will be on Tuesday the 6th of July, and that's going to be all about how to make the most of EMS. Now, I know a lot of you won't have been able to do EMS over the last sort of year and a half, so we're hoping to have some pointers about some of the protocols that may be in place for going back to seeing practice, and just how you can make the most of your time out seeing practice with vets this summer. So we hope that you'll join us on July the 6th. If you want to take a look at a recording of tonight or of any of the other clinical clubs that we've done, then you can find them all on our website. And actually our new website has gone live today, so it should be just a little bit easier for you to navigate and find our great resource centre for students on there. So thanks again everybody for joining us, and thanks to Colin as well, and good night everyone.